Right now, Canada is experiencing two parallel public health crises, the pandemic and a spike in opioid overdose deaths. In BC alone, 911 people died of an overdose in 6 months between January and July. That's more than 4 times the number of total deaths last year. So to speak about that and the growing concern about the increase in COVID-19 cases right across the country, we're joined this morning by the Minister of Health, Patty Hajdu. Good to have you back with us.
Nice to see you.
It's important we touch on both topics, but we want to start with the pandemic. Canada has now seen more than 140,000 cases of COVID-19. More than 9,000 people have died. With the cases once again on the increase in several parts of the country, are we in a second wave?
Well, I know that Dr. Tam is very, very worried about the potential of this being a second resurgence of, even numbers growing higher than they were before. And that's always the risk with COVID-19. This is a disease that requires constant vigilance, constant maintenance, constant, suppression. And so, the numbers are very, very concerning.
We talk about constant vigilance. We've seen press conferences daily by both provincial ministers as well as federal. The warnings don't seem to be getting through. We've seen strict rules being put in place in other countries to deal with an increase in numbers or second wave. Israel this week, just in its second national lockdown. We've also seen aggressive contact tracing, testing, and rules on mask use in other countries. How far will your government go in the effort to tamp down on this spike in new cases?
Well, we've always said that we'll be there for Canadians, we'll be there for provinces and territories, no matter what it takes. I will just say on the issue of national lockdowns, I don't believe that's the appropriate way to go for Canada. We have parts of the country that have had no cases, even through the first surge. Those regions are important economic drivers for our country, and people need the normalcy of living lives to the best of their ability, given the realities and the restrictions that are in place. But I think the approach that we're taking now, which is a more surgical approach, using all kinds of public health measures, including reduced gathering sizes and closures of certain types of businesses, I think that's a more appropriate approach now that we know so much more and now that we actually have a better way to manage and treat this illness.
The WHO very recently said that countries have a very tough choice to make, and they made the comparison between opening businesses or opening schools. The WHO says countries across the world have to be making some tough choices as we head into this second wave, this second spike. How far are you willing to go to make sure that Canadians remain safe, that we can stop community spread?
Well, as you know, those choices are made at the provincial level, but like I said, our government is willing to go as far as it takes to support provinces and territories to have the tools that they need. The $19 billion that we transferred to provinces and territories, $2 billion alone to Ontario, to improve capacity, to test, to contact trace, to manage, to isolate. And we continue to be there for communities. For example, as you know, last week I announced $13 million for an isolation center for Toronto. We're working with Peel Regional Health to understand what tools they might need, including isolation centers. So the federal government will have the backs of communities, and we will have the backs of Canadians. But at the decisions around what should stay open and what shouldn't, those have to be made by premiers and by regional leaders.
You brought up testing, and you've seen these pictures too, those long lines at testing centers, and sometimes people being turned away after waiting for hours. So what are you hearing about when we might get new testing methods with faster results for people?
Well, I know this is the talk of the day, the rapid tests. And of course, the entire world is searching for technology for rapid testing that will provide accuracy that won't make matters worse. Many people will point to the U.S., for example, that have approved some rapid tests. But of course, the U.S. is also struggling with some of those tests and not knowing whether or not people have tested positive, not having the accuracy of those tests, having to call back some of those tests. So in Canada, what we want to make sure is that whatever tool that we provide to Canadians, that it has been thoroughly assessed by our incredible scientists and researchers, and that we have confidence in its accuracy, and that it's not going to actually make things worse on the ground.
Turning now to the opioid crisis, before entering politics, you worked in public health. You were the executive director at the Thunder Bay Shelter House. You spent several years with public health department, including harm reduction. If you were still a frontline worker and not a government minister, what would you say we need to do to get a handle on this crisis?
Well, as a matter of fact, and thanks for the question, you bring me back a number of years. I actually wrote the Thunder Bay Drug Strategy. So that was a 4-pillar strategy to deal with harmful effects of substance use. And in that strategy, it talked about, and it was built on the BC work of treatment, enforcement, harm reduction, and prevention. And we added a fifth pillar of housing. And actually, that work in drug policy is what drove me into politics, because in fact, federal governments have a role to play. I think the work that we've been doing, in particular around meeting people who use substances where they're at with some of the harm reduction tools that communities have said they need, has been an important hallmark of our Liberal government. And I think compassion, it has to be at the root of how we talk about substance use. So, for example, the safe supply work that we're doing, we know that much of those overdose numbers that you quoted at the beginning of your segment are related to people accessing even more toxic drugs on the street. So, my perspective is that communities and community organizations know what they need, the tools that they need to actually help people who use substances get better and to move on in their lives. And my job as a federal minister is to try and unlock those tools for them.
Really quickly, would you support Ontario implementing a measure that BC did, which gave nurses the right to prescribe alternative and safe drugs?
Absolutely. Listen, I wrote a letter to all of the provinces and territories urging them to look at all options that they have to increase access to supports for people who use substances, because we know that people are dying of overdose from opiates. We know that people are struggling with other substances. And actually, what we need to do is work even faster to meet people where they're at with an appropriate blend of supports. There is no one answer, because there are so many different kinds of situations. For example, many people dying of overdose are fully employed, in particular young men that are working hard in the trades and in many other different sectors. What works for that particular population may not work for others. And so we have to make sure that we're all working as hard as we can to understand who needs what supports and then making those supports available.
Minister Hajdu, thanks so much. We know you'll be making an announcement on funding for overdose support a little bit later today. We'll be watching for that. In the meantime, thanks for joining us this morning.
Thanks for having me. Great to see you again.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.